reason is to prevent ulcers from coming, chronic venous insufficiency ulcers. And the second reason is to decrease the risk for thromboembolic complications from varicose veins. It's a combination of things why people miss vein appointments. One is some of it's financial, some of it's the fear of the unknown, and some of it is the time. And so what we do at Center for Vein is we try to make it convenient for patients to come. They don't have to miss any of their time from work because we can do them before work, during lunchtime, or even in the evenings. Our latest appointment is almost like 5 o'clock. And we don't have a problem with staying late if we know that patients. And the reason why people worry about the time component when we do a treatment plan, sometimes the plan includes multiple visits. And it's a reason for that because we do our quality assurance to make sure we don't have complications after doing procedures. So we do a vein at a time and then check it to make sure there's no complications, because our safety is the most important thing when it comes to your vein health. Now with the financial stuff, sometimes they want to know the multiple visits, do I have to pay multiple copays? And sometimes that's the concern, but most of the time after we explain to patients that you're just not here just to get a follow-up scan, we actually do the next procedure at the same time. So we try to make it worth people's while. And if we can get by and doing multiple things at the same time and it's safe, then we will perform it. And with the safety is the most common thing that we have. Because in the end, it's more financial burden for them to have an ulcer fixed than not. Now, the other thing is the venous thromboembolic complications from the varicosities. They put you at 5 times increased risk. Now, lots of patients don't understand about DVTs, but DVTs is the number one thing that kills people in the hospital and out of the hospital. So this is why we try to make sure that we actually try to do scans to make sure they're not at risk, try to decrease the risk as much as possible, and tell patients about compressions and how they can alleviate some of their risk factors. Now, when you miss some of the appointments, the lymphedema gets worse, the swelling gets worse, and performing your daily activities get worse. Now, when you miss an appointment, when you're close to a threatened ulcer, now when you come in, you have ulcers. Now, for trying to alleviate venous insufficiency ulcers, of course, it can be a year to 2 years before you can get the ulcer to heal. And then sometimes we have reoccurrence of that ulcer. So we've had patients that missed the appointment and haven't came, and then they come back later. And when they come back later, now you're in the ulcer phase. It makes it more difficult, more challenging to fix. Same thing with the varicosities, with the varicose veins. The varicose veins always end up around the ankles to create venous insufficiency ulcers. Now, ulcers don't make you lose the leg. It's when the ulcer gets infected, and that's when you lose the leg. So it's caused more time at work, more time, and more financial strain on the patients when they miss those appointments and they develop ulcers. So we want to fix you before you develop ulcers. We don't mind fixing you while you have the ulcers, but it's more strain on the patient after they've had an ulcer. We're still working out some of the great details because lots of patients, especially in the South, are not accustomed to and like telehealth. They actually want to see the doctor and be touched and get the familiarity. Now, you can alleviate some of those with the telehealth because we have Zoom and we can visualize some of the things. And we actually are trying to make the leap so you can do a little bit more with the telehealth and answer your question. We have a slogan here: if your legs are aching, come see Dr. Aikens. But what we actually do is we tell our referring physicians that if they think it's venous insufficiency or if they have a swollen leg, come see us and we'll try to sort it out. Like for instance, earlier this week, we had a patient that came to see us, and true enough, they had venous insufficiency, but their major problem was arterial insufficiency. And for us, arterial insufficiency sort of trumps venous insufficiency. Because if you have arterial insufficiency, you can't wear compression stockings. The venous things can cause you to lose your legs through ulcers. So you have a little time, but the arterial things lead to more amputations a lot quicker. So what the worst thing you can do is delaying health. And unfortunately, in this day and age, people have a lot of other things going on while they delay health. But just like most of the chronic illnesses, if you delay health, you make things worse. Are not a fix. They're like a temporary band-aid for venous insufficiency. So they actually pull the valves close together and lessen the venous insufficiency. But once you take the stockings off, or once you've been on your feet a long period of time, it allows more venous insufficiency turn to be called reflux. And if the reflux worsens, that's what creates the varicose veins. So if you have someone with a cold foot, 9 times out of 10, it's not venous insufficiency. It's more of arterial insufficiency. But there's other things that masquerades that. So that's why we tell our referring docs, if they're not sure, send them over here and we'll try to sort it out and get the patient the best and quickest relief and help. And we get a lot more for swelling. And so I tell lots of the referring and some of the patients that come, we have semi-excluded some of the venous insufficiency, and it could be lymphedema or lipolipedema. And unfortunately, if they have so much swelling, it actually decreases the amount of venous insufficiency. But I tell them also, if you have a component of both, you fix the venous insufficiency first, and that will lessen some of the swelling and edema as you fix it. And then you work on the lymphedema. And that's something that you have to do. And so we really try to be a total vein care, a total care of your legs. So when we say fix your legs, we really mean fix your legs.